Hello, this is Tatum and Lydia's presentation on Sachs disease. Sachs only affects people with the genetics of an Ashkenazi Jew. A 4-base pair insertion in exon 2 results in an altered reading frame for the hexa gene. This mutation is most commonly found in Ashkenazi Jews. This mutation leads to infantile form of Sachs. This is a picture of Lydia and I. This is where our video recording will go. The left picture is the brain when you have Sachs. The right is a chart. I will explain. Unaffected carrier father marries unaffected carrier mother. They have 4 children. Since they are heterozygous, they will have 2 heterozygous children. One homozygous that has Sachs and one homozygous that does not have Sachs. This is the pedigree I myself drew. Both the original parents are carriers of Sachs. They had one child that also carries Sachs. The carrier female married a normal male. Together they had a carrier child. That child married a heterozygous woman. They had 4 kids. One who had Sachs, 2 carriers of Sachs, and 1 normal child. Other citations. We used Mayo Clinic, Midland Plus, rare diseases. Okay. This is what biology is doing to us. This is just a slide we messed up, so I decided to keep it in there. This is the actual slide. Our genetically transmitted disease is known as Sachs disease, also known as GM2 gangliosidosis. It requires a medical diagnosis. Sachs is known to occur in Ashkenazi Jews. As we know, it occurs early in a baby. Symptoms that develop slowly tend to appear around 6 months of age in a baby. Sometimes progress until baby dies, which is predicted to be around the age of 4. The infants may experience in a muscular aspect, muscle weakness, problems with coordination, arrhythmic muscle contractions, or stiff muscles. Throughout the whole body, symptoms may contain feeling faint. Some other common symptoms are difficulty swallowing, trouble speaking, hearing loss, vision loss, or seizures. Sachs disease affects the nerve cells in the brain and spinal cord. I'm sorry for the typo, I will fix. It occurs early in life. Babies develop normally from 3 to 6 months. Then after that time, the development and muscles used for movement begin to slow. They start missing important development milestones. This is caused by the alteration in the hexa gene on chromosome 15. Treatment. Unfortunately, there is no cure for Sachs disease, and no treatments are currently proved to slow progression of the disease. The probability of an infant getting Sachs is 1 in 3,500 newborns, and the carrier's probability is 1 in every 29 individuals. People tend to carry Sachs way more than naturally having it. This is a very rare disease, regarding the fact that it can only occur in certain ethnic groups, as I've stated before. Increased occurrences of Sachs is reported to happen in families who live in the Cajun community of Louisiana, southern East Quebec, Canada. Also, research. As there is currently no successful treatment for individuals with Sachs disease, there is a need for significant research into therapeutic techniques that could be useful in the treatment for the disease.